Aseptic technique. You hear this term thrown around all the time in clinical settings, right? But it's so much more than just a buzzword or a procedure. It's the fundamental shield we create between our patients and a world of potential harm. So let's dive into this comprehensive report and really break down what makes this practice an absolute cornerstone of modern medicine.
You know, the fight for patient safety isn't always against something you can see. In fact, some of the biggest challenges we face come from microorganisms, that invisible threat that's just always there in the clinical environment. And aseptic technique? Well, that's our #1 strategy in this invisible battle.
And this is what we're up against: healthcare-associated infections, or HAIs. These are not illnesses a patient walked in with, these are infections they picked up while in our care. They represent a serious breach in patient safety, and they are exactly what every single aseptic protocol is designed to stop. The stakes really couldn't be any higher. All right, to really get our heads around this, here's our game plan. We've just touched on the invisible thread. Next, we're going to explore what's called the ANT paradigm, then see how asepsis looks in the real world, check out the tech that's helping us, and finally, wrap up with the absolutely critical medical legal standard. So, how do we build a standardized defense? Well, we move on from that old, kind of fuzzy clean versus sterile debate and into a much sharper framework, the aseptic non-touch technique, or ANTT. This is the modern, evidence-based approach that's changing the game. Okay, now take a look at this diagram because it beautifully visualizes the whole process. See the flow? You've got the healthcare professional, who is a potential source of contamination. They're using sterile equipment, which has a critical component we call a key part. The goal is to get that key part to the patient's vulnerable key site, say an open wound, without it ever touching a non-sterile surface. That clear, unbroken path, that's the ANTT sterility chain. And the core rule is simple. The practitioner does not touch the key part or the key site. That single discipline is what prevents contamination. It's that simple and that powerful. Let's really nail this down. On the left, we've got key parts. These are the mission-critical surfaces of your gear. Think about the tip of a syringe or the absorbent pad on a sterile dressing. Then, on the right, you have key sites. These are the patient's entry points of vulnerability, like an IV insertion site. The entire purpose of ANT is to make sure that a key part only touches a key site. That's it. You maintain that sterile-to-sterile connection, and you win. So we've got the theory down. But how does this all translate from a neat diagram into the messy, fast-paced reality of clinical work? Let's move from theory to action. Now, in practice, one size does not fit all. And this table shows that perfectly by comparing medical and surgical asepsis. For something like a chronic wound, your goal might be to simply reduce the number of pathogens, using clean gloves in a generally clean area. But for surgery or a fresh acute wound, the objective is absolute, 0 microorganisms. That means certified sterile gloves and a strictly controlled sterile field. The key takeaway here is that you, the practitioner, have to use your clinical judgment to choose the right tool for the job. And no matter which type you're using, the process has to follow this exact linear sequence. It's a chain, and every single link has to be strong. First, you prep the environment. Shut the doors, limit foot traffic to cut down on air movement. Then, it's all about meticulous hand hygiene. Next, when you cleanse the wound, you always go from the cleanest part in the middle outward so you're not dragging germs in. And finally, you protect your sterile field by always remembering that 1-inch border is considered contaminated. You break one step, you break the whole chain. Of course, modern practice isn't just about technique anymore. It's also about the tools we have at our disposal. Technology and constant vigilant surveillance are now a huge part of maintaining asepsis and, just as importantly, catching any failures early. And this chart gives you a great snapshot of what that modern toolkit looks like. Negative pressure wound therapy, or NPWT systems, make up a huge chunk, 45%. These absolutely demand surgical asepsis, because if that vacuum seal is broken, the whole system can become a breeding ground for bacteria. Then you've got smart dressings and biosensors, which are amazing. They let us monitor things like temperature or pH without ever having to take off the dressing and expose the wound. But, even with the coolest tech, nothing replaces a sharp eye. Every clinician has to be an expert at spotting the signs of failure. On a local level, you're looking for those classic signs of inflammation: redness that won't go away, heat, swelling, and of course any discharge or bad odor. And systemically, you're on the lookout for fever, chills, and a spike in the white blood cell count. Catching these early is everything. It's how you intervene in time and stop something worse, like sepsis, from taking hold.
And that brings us to our last and honestly maybe the most important section. Aseptic practice isn't just a clinical duty, it's a huge professional and legal responsibility. A slip-up in your technique can have some pretty serious medical legal fallout.
So why do we hammer this home so much? Why is documentation so crucial? Well, it really boils down to two big things. First, it proves you met the standard of care. Your notes show you used a recognized framework like ANTT and that your supplies were sterile. Second, and this is the big one, it is the foundation of your legal defense. If you ever end up in litigation, that detailed charting is the objective proof that you did your job right.
This table lays it out perfectly. The purpose of noting which framework you used, like ANET, is to show you followed protocol. The supply integrity check, that's your quality assurance, proving your gear was sterile. And charting the patient's response, that's for clinical monitoring, to track how things are going. See? Every little detail you chart has a real purpose and carries serious legal weight.
And this matrix. This really brings it all home. It shows why this matters for every single thing we do. Look, on the horizontal axis, you've got how complex the procedure is. On the vertical, you have the risk. Now notice where things like IV insertion and surgical dressings land. They're all considered high-risk procedures, even if we think of them as standard or routine. This visual is such a powerful reminder that there is zero room for complacency. High risk means high adherence every single time.
So in the end, aseptic technique isn't some abstract idea from a textbook. It's a chain of very specific, deliberate actions, carried out by you, a dedicated professional. It all comes down to individual knowledge, skill, and just plain old vigilance. So I'll leave you with this question to think about. In that critical chain that protects your patient, where are you its strongest link?